Mounjaro and Zepbound both contain Tirzepatide, but their approved uses differ. Mounjaro treats type 2 diabetes. Zepbound treats obesity or overweight with related health problems and moderate to severe obstructive sleep apnea in adults with obesity. For adults, both start at 2.5 milligrams and may reach 15 milligrams. Side effects often intensify during increases, but trial percentages are not interchangeable. A higher dose is not automatically better. Despite their different names and uses, Mounjaro and Zepbound should not be used together. Both deliver Tirzepatide, so combining them would duplicate treatment. Both products are injected once weekly. Treatment starts at 2.5 milligrams for 4 weeks, then increases to 5 milligrams. Later, increases use 2.5 milligram steps after at least 4 weeks at the current dose. The adult maximum is 15 milligrams weekly. The purpose of each dose depends on the brand. For Mounjaro, 2.5 milligrams starts treatment but is not intended for blood sugar control. For Zepbound, 2.5 milligrams is also only a starting dose and is not an approved maintenance dose. For Zepbound weight management, the recommended maintenance doses are 5, 10, or 15 milligrams. The 7.5 and 12.5 milligram doses usually serve as steps between maintenance levels. Benefits and side effects determine whether moving higher makes sense. The dose rises slowly because Tirzepatide delays stomach emptying and strengthens fullness signals. Food can remain in the stomach longer, so a normal meal may suddenly feel excessive. That effect can reduce appetite, but it can also trigger nausea, reflux, bloating, diarrhea, constipation, or vomiting. Expected adjustment must be separated from symptoms that disrupt daily life. Mild nausea or loose stools may appear after starting or increasing. Large meals, greasy foods, alcohol, and eating quickly can make those symptoms worse. Symptoms that are mild, improving, and manageable usually fit early adjustment. Repeated vomiting, poor fluid intake, or symptoms lasting most of the week should stop an automatic increase. Having no side effects does not mean Tirzepatide is failing. Blood sugar, appetite, weight trend, waist size, and daily function provide better evidence than nausea alone. At 5 milligrams, appetite suppression may become clearer, and post-meal fullness may last longer. However, Mounjaro and Zepbound reported different side effect percentages because they were studied in different populations and trials. In Mounjaro diabetes trials, nausea occurred in 12% at 5 milligrams. In Zepbound weight management trials, it occurred in 25% at the same dose. Different populations produce these group averages, so they cannot be directly compared or predict one person's response. Consider 2 patients after moving to 5 milligrams. One has mild nausea for one morning, then eats and drinks normally. Another loses appetite for 5 days and struggles with fluids. The second pattern matters more because hydration and nutrition are impaired. The 7.5 milligram dose is an intermediate step, not a required destination. Official side effect tables do not provide separate percentages for every intermediate dose. Your response at 5 milligrams, therefore, matters more than inventing a precise risk for 7.5. By 10 milligrams, nausea reached 15% in Mounjaro diabetes trials and 29% in Zepbound weight management trials. Diarrhea reached 13% with Mounjaro and 21% with Zepbound. These figures still cannot be directly compared as if they came from one study. More appetite suppression can produce a worse overall result. If you cannot drink enough, meet protein needs, sleep normally, or stay on schedule, a higher dose may work against treatment. Remaining at a lower effective dose can then be the better choice. Constipation does not always rise with the dose. Mounjaro trials reported 6% at 5 and 10 milligrams. Zepbound trials reported 17% at 5 and 14% at 10. Less food, less fluid, and slower digestion can cause hard stools. The 12.5 milligram step test tolerance again before the maximum dose. Someone comfortable at 10 milligrams may struggle after this increase. Compare the new week with your own previous 4 weeks, not with another person online. At 15 milligrams, nausea reached 18% in Mounjaro trials and 28% in Zepbound trials. Vomiting reached 9% with Mounjaro and 13% with Zepbound. These group averages explain why the highest dose deserves closer observation. Persistent low intake can create problems beyond nausea. Weakness, declining strength, repeated skipped meals, or difficulty meeting protein needs may indicate inadequate nutrition. A falling scale is not reassuring when daily function is also falling. Timing also matters. In both labels, nausea, vomiting, and diarrhea occurred mainly during dose escalation and generally decreased over time. Symptoms can return after an increase even when the previous dose felt comfortable. Weekly doses overlap because part of the previous injection remains in the body. Tirzepatide builds toward a steadier level over several weeks. An easy first week after increasing does not guarantee that later weeks will feel identical. Meal size can explain why symptoms vary between weeks. A large fatty meal stretches a stomach that is emptying more slowly. Eating past fullness can turn mild pressure into reflux, nausea, or vomiting. Judge each dose by daily function, symptom duration, and recovery before the next injection. A dose remains tolerable only when hydration, nutrition, sleep, activity, and regular dosing stay reasonably intact. Prevention starts before symptoms appear. Eat smaller portions, pause halfway, and stop when fullness arrives earlier than expected. Sip fluids across the day instead of forcing a large volume during nausea. Choose simpler meals when symptoms flare. Keep the routine consistent when possible. Record the injection day, meal size, nausea duration, bowel changes, fluid intake, and missed activities. 4 weeks of notes can separate brief adjustment from a dose that remains disruptive. Low fluid intake, reduced urination, dizziness, or weakness can signal dehydration. Vomiting and diarrhea can remove water and salts quickly. Dehydration can worsen kidney function, especially in people who already have kidney disease. Inability to keep fluids down requires prompt medical contact. Another risk comes from combining tirzepatide with insulin or sulfonylureas, older diabetes pills that increase insulin release. That combination can raise the risk of low blood sugar. Sweating, shaking, confusion, or unusual weakness should prompt a glucose check and medication review. Dose escalation can also affect oral birth control. Slower stomach emptying may reduce absorption after starting tirzepatide and after each increase. Use an added barrier method or non-oral contraception for 4 weeks after starting and after every dose increase. Severe symptoms do not belong in the normal adjustment category. Severe, persistent abdominal pain that moves toward the back can signal pancreas inflammation. Right upper abdominal pain with fever, yellow skin, or pale stools can suggest gallbladder trouble. Facial swelling, breathing trouble, or fainting requires urgent help. Before increasing, review symptom severity, the number of difficult days, fluid and food intake, and treatment benefit. For Mounjaro, that benefit may include better blood sugar. For Zepbound, it may include weight reduction, appetite control, or improvement in moderate to severe obstructive sleep apnea. An increase makes sense when the current dose is tolerated and more benefit is needed. A delay makes sense when symptoms are still settling. A lower dose or different plan may be necessary when side effects remain severe, persistent, or disruptive. The best Mounjaro or Zepbound dose is not the highest number you can reach. It is the lowest dose delivering enough benefit while preserving daily function. After each increase, judge the whole week, not one injection day, one meal, or one scale reading. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.